Alright, so for the aptly scratch test, you have the patient seated. First, I'll ask them to just take their arms with this arm. Just go ahead and reach over and grab it up, touch your shoulder. Just assess their range of motion. The next one, I'll ask them, go arm overhead like they're scratching their back. Test that. And then for the last one, have them pin their arm behind their back. So, I can turn here. This just checks their range of motion and then also for any impingement symptoms. So then you do both arms and you compare bilaterally. Alright, so the empty can test, you can test the supraspinatus. So I'll have the patient seated here. I'll ask you to bring your arm out, 45, internally rotate. Then I'm going to stabilize up here to shoulder. I'm going to push down, so don't let me push down. Assess that. Then you compare bilaterally to see any strength. So for the drop arm test, first I'll bring the patient's arm up overhead here. And then I'll ask them to just slowly, eccentrically lower it. I'll just kind of have my hands here in case you can. That also tests the supraspinatus. Alright, so for Neer's impingement sign, we'll just first have them passively just raise their arms straight up here, assessing for any pain, any signs of impingement. Just bring it back down. Like I said, that assesses for any impingement. So for the impingement sign test, I'll have the patient first seated, and I'll have her actively just raise their arm, just raise your arm straight up overhead. And bring it back down. We're just assessing for any impingement or any anterior impingement. Alright, so first test we'll do is Addison's, test thoracic outlet syndrome. First, I'll have the patient, she can be seated here. Bring her arm out. First, I'll get her pulse. Once I get that, then I'll have her look down at her hand and take a deep breath. And hold that. And while you're doing this, you just assess to see if her pulse diminishes. And if that's the case, it's positive for thoracic outlet syndrome. Next test we'll do is Allen's test, also for thoracic outlet syndrome. So I can have her seated here, bring her arm out, put her like a goalpost. I'll get her pulse. And now that I have her pulse, I'll have her go ahead and turn her head away, hold your breath. And similar to the other one, you just assess to see if her pulse diminishes. Alright, so for Roos test, I'll have her seated here. First, I have you go into a goalpost, like your arms like this. And go ahead and open your hands about 25 times. And then a positive test would be if she loses any sensation in her hands while doing this. And that'd be positive for thoracic outlet syndrome. Okay, this next test is a military brace test. So I can have her seated like so. First, I'll bring her arms back, extended position, about here. And then I'll have you, while you're in this extended position, I'll go ahead and just like extend your head all the way back. And then this is a positive test would be if she loses any sensation, any circulation, that'd be for thoracic outlet. Okay, so for the O'Brien's test, we have the patient seated here. First, I'll have her start in a supinated position on her side. I'm gonna have her go across, and then she's gonna go across and pronate at the same time. I'm gonna resist that motion. Go ahead. She comes across. That tests for a slap tear or slap lesion at her labrum. So for the slap prehension test, first I'll have her seated like so. We'll start out. Supinated position, arm out. I'm just gonna ask you to just go across and I'll resist that motion. Go ahead. Check that. I'll bring it back out. The next one, you can go pronated position, same thing, resist or going across in the adduction. That also checks for a slap tear or slap lesion. Alright, so for the Hawkins-Kennedy test, I can have the patient seated here. Go ahead and bring your arm up, almost a 90-90, not quite just 90 degrees. Abduction, I can slightly horizontally adduct her. Doesn't have to go all the way in, it can be about here. Now let's go ahead, stabilize the elbow. Just internally rotate, closing off the subacromial space. You're looking for any pain in the anterior portion of her AC joint, which would be a positive sign for impingement. The next test is the sulcus sign, and this looks for any inferior laxity of her capsule. So I'll just have her seated here. I can just go ahead and grab her arm, pull inferiorly here, and then if it was a positive sign, you'd see a little right under her deltoid. You'd see like the sulcus sign right here. That'd be for inferior laxity. Alright, so speeds test. We're gonna be assessing bicep tendinopathy or any bicep tendinitis. So first, I'll have the patient seated. So let's bring your arm out in a supination here. Put my thumb on the bicipital groove. And then I'm just gonna ask her, I'm just gonna resist her as she goes into shoulder flexion. So go ahead. Go back down. Then a positive test would be any pain in the bicipital tendon, or like with the bicipital tendon slips out of the groove. Alright, so Yergason's test also tests for bicep tendinopathy, bicep tendinitis, any discomfort up here. So same thing. First, I'll put my thumb on the bicep tendon, and then go ahead. I'll bring your arm pronated across her body, and then I'm gonna resist her as she goes into extension and supination. Just go ahead, resist her here, supination. Same thing, looking for any pain in her bicep tendon or if the tendon slips out of the bicipital groove. Alright, so the anterior drawer test of the patient seated. Just go ahead and put my hands, get my hands around her humeral head. And I'll just anteriorly slide it, getting to the end range. And then a positive test would be like if the humeral head goes past the space in the capsule, and then it'd be positive for any renal humeral instability, potentially a dislocation. So the posterior drawer test of the patient seated, similar to anterior, hands just around a humeral head, so I'll find it. Just push posteriorly to the end range. Once I get there, a positive test would be if there's any excessive laxity in her capsule as I go posteriorly, or a potential posterior shoulder dislocation. Alright, so the AC shear test, first I'll have the patient seated. Go ahead and put my hands on the spine of her scapula, I'll find that, then her clavicle. I'll go ahead and just compress, trying to open up the space at her AC joint. And then a positive test would be any pain in her AC joint, and it would be positive for AC joint instability. Alright, so for the jerk test, first I'll have the patient seated. I'll bring them up into about 90 degrees of abduction. Get my hands on her elbow here. I'm going to give an axial load through her humerus, and I'm going to horizontally adduct her. As I go through this, feeling for any clunking as the humeral head clunks off the inferior aspect of the glenoid. And then this would be positive for a posterior inferior labral tear. So for the piano key sign, it's not really a test, but the patient would come in, they'd be presenting as it'd be for an AC joint dislocation, so her clavicle, as it come across here, be kind of sticking up. As you come across, you just kind of see it sticking up like a piano key. Like I said, that'd be positive for an AC joint dislocation. Alright, so for the clunk test, first I have the patient supine, and then here I'll actually slide over a little bit, so they're slightly over the table just a little bit further. Here, right there. First I'll put my hand under their humeral head here, just relax. And then from here, I'll kind of slightly abduct, and then bring the patient's arm overhead, actually hand should be above the elbow. Get back on here. Go ahead and I bring it up, bring your arm overhead, and as I'm doing this, I'm feeling for any clunking or grinding sounds, which would be positive for an anterior superior labral tear. Alright, so for the grind test, I'll have the patient supine. First, I'll bring your arm out into 90 degrees of abduction, and then I'll apply an axial load through her humerus. As I'm doing this, just circumduct at his shoulder, feeling for any grinding or clicking, which would be a positive sign of a labral tear. Okay, so for the apprehension test, I'll have the patient supine. However, just slide a little bit close to me, a little bit off the table. Perfect. Then I'll go bring out 90 degrees of abduction. And as I'm doing this, slowly go out in an external rotation. And a positive test would be any like apprehension where the patient like jerks back in internal rotation or any pain, which would be a positive sign of a anterior shoulder dislocation.